his spare time likes to threaten handsome DJs. Anyway, so yeah, he was saying that why are people asking about a plan? She did this, she spent this money here, she spent... But that's not a plan. A plan is before you spend the money. We know what you're going to spend the money on. A plan is not like, hey, I spent $500 on this thing. That's not a plan. It comes before the action. That's what I learned in school. I don't know if they changed it. Apparently, they might have changed it. But that's the last time I heard is when you plan a plan, like, for example, an American Rescue plan for spending that money, that would probably mean that you would have something on paper and be like, we're going to spend it here, we're going to spend it there. Not this, like, they spend it on something and then 2 weeks later we find out by accident because someone snitched. That's what's going on right now. That is what's going on right now. That's why I didn't even get that whole interview with him where he was talking about, didn't she help the poor people? God, what's you guys' problem? Why you want to know everything? We want to know everything because your chief of staff said you're a 10 out of 10 transparency of me. 709, The Link, good morning. Let's go in with our COVID consultant here. He's the former Physicians Advisory Group chair. They worked a lot harder when he was the PAG chair because I don't know what they do now, but it doesn't seem like they changed much. He is also the head of American Medical Center Clinic Family, Dr. Hoa Nguyen. And Doc, you've been kind of, well, not kind of, way back in this. We're now in week 13 of this surge, by the way, guys. Just the deaths in October. In October alone, 28, right? 20. It's more than a death a day. It's insane. It's insanity that these deaths continue to happen. We have this high number of positives, and he was one of the guys at the very beginning who was calling for restrictions that maybe could have changed the course of this tidal wave of COVID we're all drowning in. But all for naught, as they gave him a deaf ear. And now he's here on our show. Thank you for joining us, Doc. And I wanted to just real quick get the reaction. This is a story Sabrina Sosmet-Tanani worked very hard to get. And we were reaching out to public health, Director Artson Augustine, and anybody, all day to confirm this. And there was no response until a press release came out. Get this, Dr. Hoa. This press release came out at 11:45 last night.
Wow.
Before midnight, from the Department of Public Health and Social Services. And the story here from Sabrina, who beat the press release by, God, almost half a day. CDC also deploying team to assist frontliners. KUAM has confirmed that the CDC prevention has approved public health's request for technical assistance. So public health was basically like, CDC, help! And Doc, you've been kind of calling for this. So according to the late night / early morning release from DPHSS, the team of deployers to Guam to support case investigation and address the dead on arrival cases related to COVID-19. So our COVID situation, Doc, is so bad, especially with these dead on arrivals, that we got a team from the CDC coming here. And what are we going to tell them? We had all these dead on arrivals because we put in place this ridiculous mandate that targets the unvaccinated that did absolutely nothing to stop the positive cases or to stop the deaths. So I don't know how it's going to work, but just your reaction, Doc.
Yeah, I mean, it's great. Appreciate the public health asking CDC to come over and give us some assistance here on trying to figure out, why we have so many DOA. We have quite a few that we know that they care enough to go get tested, and they was tested positive. But I'm not quite sure why do we, either we failed to reach out to them to offer the monoclonal antibody, or we didn't identify the risk factor. I don't know which one, but we really need to figure out what ethnicity they are. When they get tested, do we identify them on time, or they didn't get the information? Whatever the reason is, I think that is at this point, if they care to get tested, we should be doing everything we can to try to prevent the DOA. It's the last one, the 50-year-old that partially vaccinated that known that they test positive already, but still have DOA. So they really need to take a look at that, and that's one part where um, I think that CDC will be great to just take a look at and let us know what we can do to improve the situation. And also, why they here, they need to take a look at the breakthrough case that we have to see why we have so much. That's the part where I know that Dr. N put together data there that they're about 36, no, about 34% or something that breakthrough case. That's still pretty high. We just need to figure out what do we do wrong, because like I say, everywhere else in the state and the island, that if they have somewhat a decent vaccination percentage, that their cases are going down, and our case is still kind of hovering 100 and with 10% plus positivity every day for a long time. That's a big concern.
Doc, we're talking about this, the breakthrough cases. Dr. Ant did release a graphic here. I know I sent it to you last night. I'm sure you saw it anyway. Just kind of going through the different vaccine brands and the breakthrough infections associated with those brands. And, if you want to just look at it like a product review, maybe, Pfizer, but Pfizer had the most shots given. So 61,993 people vaccinated with the Pfizer brand, and of those 61,993, we saw 2,233 breakthrough COVID-19 infections. With Moderna, it was 29,839 vaccinated, 901 breakthrough infections, and then J&J was 5,631 people vaccinated with 232 breakthrough infections. So, if you look at the numbers, Moderna, which is what I've been saying, I'm team Moderna, guys. Moderna has extra juice in it, right? And so if you look at the numbers, but they don't really vary that much, and that's kind of what Dr. Ann's data said. She said that there doesn't really look like there's a difference for better or worse between the vaccines. But she also included this breakthrough infection rate per 1,000 people vaccinated, and it was Pfizer with 36 people per 1,000 breakthrough cases. So that means 36 people out of 1,000 got COVID. Moderna was 30.2. Johnson & Johnson was 41.2. So those are the numbers. But what was interesting, Doc, is if you look, and we have this other graphic here, in the states of America, the breakthrough case rate is less than 1%, right? So we're looking at our breakthrough rate. That's a huge difference.
Yes, that's a big difference, but you had to kind of be careful. The report for the breakthrough case, is a voluntary things that the state and territory are put it in to CDC, so that way they can track it. So it's voluntary, and the definition of breakthrough rate is if you have an infection 2 weeks after you've fully vaccinated, but recently in May of this year, CDC also add the category for people in a breakthrough rate that end up in the hospital. So I'm not sure which one are they looking at, the 0.0002% breakthrough rate in the states at the hospital admission, or that's all the breakthrough. Again, the process to input this data into CDC website for report the breakthrough is pretty complicated. The question is, does the state, the territory, especially Guam, if we do have the manpower to input the data to CDC or not? That's the question. I know we track it locally, but I'm not sure if we put everything in the database so that way CDC can track it. And the other one is that we have the number of people in the breakthrough per 1,000. It's really nice to know to break down a lot more, like the timeline that when people get the the vaccine and when they get the breakthrough infection. And on the average, I think she said like 4.5 months.
Yeah.
So that's pretty short. So I know that we have a lot of comorbidity. It's nice for someone to kind of gather the data and basically we can do the measurement now of the neutralizing antibody, right? To make sure that if I'm 3-4 weeks after I get vaccinated, fully vaccinated, I can measure the level, and then maybe 3 to 4 months later, I can repeat the lab to see where my neutralizing antibody level are, and so it's something like that you can track to see if we have comorbidity like diabetes, especially on our island, that hey, does our immune system working well or is waning away a lot faster than the normal person. So a lot of things like that we can do. Like I say, it's very important for us to ask CDC to kind of look at our island because it's very unique, as you can see the number, because we all have to plan ahead of time. Is that the key here is that Delta is not going to be the last one. We're going to encounter another variant in the next few months. And we need to know, hey, what else we need to do differently to kind of prevent the surge from coming, right? I mean, it's too late now. Everywhere in community that we have the positive at this point. So it really, we just kind of do our best and ask our people to isolate themselves and go get tested and try our best to try to curve this surge right here. But it's very important, as we know that the immunity is going down so fast. The people out there that need to come out and get the booster in order to get the immune system to come back up to at least 85-90%. So I really, really encourage people to go out there and get the booster as much as possible.
Doc, you seem very frustrated by all this.
Yeah, it's I think it's not just me. I think our whole healthcare system, our staff and the hospital especially, I know everyone, the healthcare, the front line are working very hard. And I tell you, it's and people get beat up. We start having, healthcare worker now that turn positive. And that's something that, if we into this surge for so long, the morale and the compassion and everything that the frontliner do every day, and I feel for GMH and GRMC and the Naval Hospital. Those guys, I tell you, I don't know how they do that to go to work every day and still feel compassionate for what they do. Because I tell you, it burns you out when you have to do this every day and you have to go home and worry about your family.
Yeah.
I really pray and really hope that they can continue to do what they do. And my hat's really off for all those people in the hospital.
Yeah, I feel for the frontliners because we did a hospital tour and they were all saying the same thing. Damn, we're tired. We're exhausted. How are we going to keep going? But if I was a frontliner, I would be upset that our government in this COVID response hasn't really done anything different for, a couple months. I would be insulted. Like, hey, do something. Stop all these people from coming in the hospital. So it's got to be frustrating for the frontliners too.
Yeah. So that's when it's nice. I'm happy to see the CDC coming. I tell you, if Sabrina can confirm that, I think it's wonderful news for us. And we just, we will learn something come out this thing, and hopefully we will change our direction and do something else different.
Yeah.
That's about our people here on the island, and that's what we do. Every life counts, and I tell you, it doesn't matter the vax or unvax. We lose a life. We have to look at why we're losing them, and that's something that is it's a strategy that we have to come up to try to prevent this thing from happening to the family. And when people say, well, people die from other reasons also, but I tell you, well, when you die from COVID, is very lonely death, and that's what I try to remind people. Right, when you pass away, you like to have your family around you, and that was your support. But when you pass away from COVID, most of these people die in the room by themselves. So it's totally different. So we have to think it that way. It's not the same thing as we die from other comorbidity like a heart attack or the stroke that we have a family around us. You know, as a primary care physician, that's what we're looking for our patient is that when they pass away, they need to be able to hold the family hand before they pass away. And this is not going to happen with COVID.
Doc, but do you think the reason why we had to force this information out of the Department of Public Health, Health and Social Services, the reason why they weren't forthcoming with this information, the reason why they didn't tell the public that COVID and this surge is so bad that we're throwing out a lifeline at the CDC? Do you think that's because the CDC coming here means that what the governor's doing, what public health is doing to control the surge is not working?
Yeah, I wouldn't look at that way, Chris. I mean, I'm basically it doesn't matter what reason that we are reluctant to have them come or not. But the good part about they are coming, and that's what I have to look for. I mean, we had to work everyone together with public health, the governor, and everyone else, wrong or right. But I just glad that wrong or right, they are coming. So that the end point of what's matter, and that's what we have to look for. Hey, they coming, and we hope that we have an answer so we can fix what's the problem we have, and that's what we're looking for.
All right. Well, before I let you go, Doc, what are you seeing at the clinic level?
We still see a lot of positive in the clinic level, and the people don't expect that they have the virus because again, the majority of people that we see in the clinic are fully vaccinated, and when they have a symptom, they did not expect that they have, and that's the thing is that we have to keep out there and remind people that you're fully vaccinated doesn't mean that you will not pick up the virus. Again, to me, to remind people is that immunization is to really decrease the severity of the illness and kind of cut your risk of being in the hospital, but does not mean that prevent you from getting the virus. So you have to be careful out there. So we still see, unfortunately, we see more kids now. That's a problem. So we cannot wait until we have the vaccination from 5 to 11, which is hopefully sometime the mid-November. We should be able to roll that out. But yeah, we see an increase in the positive in children from the clinic standpoint. So parents, you have to kind of be careful about your children.
Dr. Ann Pobutsky did a data drop yesterday, and she was saying, well, the data is showing that there's a very slight, very gradual downward trend in cases and hospitalizations, and a downward trend in all age groups except for children 0 to 11, and they now constitute the group with the highest case rate. So that's pretty alarming with this MISC out there. And I mean, again, most of these kids, all of them actually, unvaccinated.
Yeah. But first, we have to be cautioned on the downward trend of the hospital. Yeah. It might be a temporary downward trend if we don't control the positivity. If we keep on 10% plus, we're going to be 50 or higher for a long, long time. It might trend downward a little bit, but it will bounce back up. Because remember, the elderly, 65 plus, the majority have the vaccination in December and January. We don't have all of them come in yet for the booster. Yeah. So again, the 18 to the 50 still have the second highest rate beside the children. They're still going to bring home to the elderly. So we have to be very careful. Again, we live in a society where there's multi-generation home, right? So live our parents and we bring it back to our parents. So we have to be careful.
Right. Well, Doc, thank you so much for your time. You've always been your voice of reason on the show, so appreciate you coming by.
You're welcome. Be safe, guys.
All right. There you go. Dr. Hoa Nguyen, our COVID consultant here. He's with AMC. He's the former Physicians Advisory Group chair. Was the chief, at one time, the chief medical advisor to Governor Lulian Guerrero. 728, yep. So the CDC sending a team out there.